Hi everyone, this is Amy. Welcome to my channel. A few weeks ago, I made a video about why I still wear a mask, even though I'm vaccinated. And now masks are coming back. The mask mandates are returning, even for those that are fully vaccinated. But even before that, I started to notice an increase of views in the videos I made last year about the Under Armour masks. And my latest video about the second generation UA sports mask, it's called Featherweight, has received way more views than I thought it would. And this is because, according to many news agencies, the United States has hit a 6-month high this week regarding new COVID-19 cases, with more than 100,000 new cases on Wednesday alone. This is a 5-fold increase in new cases that have occurred in less than a month. This increase is due to the spread of the Delta variant, especially in regions of the US where uptake of the COVID-19 vaccines is low. According to Dr. Mike Hansen, the Delta variant is almost like a whole new virus. He says that it behaves very differently from the previous COVID strains. Its mutations allow it to better evade the body's immune system. The Delta variant is estimated to be at least 60% more transmissible. One CDC document suggests that Delta is almost as transmissible as the chickenpox, with each infected person infecting an average of 8 or 9 more people. Compare that to the original strain of COVID, which was about as contagious as the common cold, with each infected person infecting 2 others. New data published by the Centers for Disease Control, the CDC, indicates that Delta results in similarly high viral loads in both fully vaccinated and unvaccinated people. But before you decide not to get vaccinated based on that information, this does not mean that if you're vaccinated, you will have just as bad an infection as if you weren't. Instead, the significance of having a high viral load means that it's easier for you to transmit the virus to others that are not vaccinated, even if you don't have symptoms. For this reason, on Friday, July 27th, the CDC also updated the safety guidelines for people who have received full COVID-19 vaccinations to ask them to wear masks in indoor public settings in areas of substantial and high transmission. CDC Director Dr. Rochelle Walensky said,
"We have new science related to the Delta variant that requires us to update the guidance regarding what you can do when you are fully vaccinated. I have seen new scientific data from recent outbreak investigations showing that the Delta variant behaves uniquely differently from past strains of the virus that caused COVID-19. Information on the Delta variant from several states and other countries indicates that in rare occasions, some vaccinated people infected with the Delta variant after vaccination may be contagious and spread the virus to others. This new science is worrisome and unfortunately warrants an update to our recommendations. First, we continue to strongly encourage everyone to get vaccinated. Getting vaccinated continues to prevent severe illness, hospitalization, and death, even with Delta. It also helps reduce the spread of the virus in our communities. Vaccinated individuals continue to represent a very small amount of transmission occurring around the country. We continue to estimate that the risk of a breakthrough infection with symptoms upon exposure to the Delta variant is reduced by 7-fold. The reduction is 20-fold for hospitalizations and deaths. As CDC has recommended for months, unvaccinated individuals should get vaccinated and continue masking until they are fully vaccinated. In areas with substantial and high transmission, CDC recommends fully vaccinated people wear masks in public indoor settings to help prevent the spread of the Delta variant and protect others. This includes schools. CDC recommends that everyone in K-12 schools wear a mask indoors, including teachers, staff, students, and visitors, regardless of vaccination status. We continue to follow the science closely and update the guidance should the science shift again. We must take every step we can to stop the Delta variant and end this pandemic.
Now remember, the vaccine is great at preventing severe disease. Pfizer and Moderna, they're effective at preventing severe COVID. In addition to the CDC, this week, US Figure Skating and Learn to Skate USA both sent out messages that were pretty much effective immediately. The new mask policies for US Figure Skating and Learn to Skate USA say that masks are required to be worn indoors by all people, including fully vaccinated people, attending any US Figure Skating sanctioned event or activity despite local, state, or facility policies. Now, as most of you know, I have been and continue to wear a mask this entire time. As a matter of fact, I wear two. I wear an N95 and I wear a UA Sports mask. This is the new featherweight version. I put them on outside the rink in my car, put them both on, and I do not take them off the entire time I'm in the rink. As a matter of fact, if I feel like the mask has gotten damp on the inside, I will leave the rink, go outside to change it. I will not do that in the rink. I don't pull it down to talk. I use a microphone PA system, which I'm gonna have a video about that coming up. So if you are a coach, a trainer, or a teacher, and your students have trouble hearing you when you wear a mask, that could be a real good solution for you. So remember to subscribe and ring that bell so that when I post that, you'll be sure to see it. Anyway, getting back to the subject. I know that many people, as soon as the mask mandates were lifted, decided to stop wearing their mask. Some of those people looked at me like I was crazy because I kept wearing one. They told me, you don't have to wear that anymore. I said, no, I know I don't have to wear it anymore, but I'm going to wear it. And I made that video because I was getting a little tired of people asking me about why I wore a mask or, oh, you're not vaccinated? No, I was vaccinated in March. I drove 100 miles each way, twice, because I had to go to the same place for my first dose and my second dose. I drove 100 miles each way to get my vaccines because it was so early on that I couldn't get one anywhere near me. So I drove quite a ways. To say I was eager is an understatement. Now, getting back to these new policies from US Figure Skating and Learn to Skate USA, it's unclear to me what they actually include. So I have reached out to US Figure Skating with that question, and as of the time I'm recording this video, they unfortunately haven't gotten back to me to clarify. Editing Amy here, I just got a response back from US Figure Skating. It's from Senior Director of Membership, Susie Hurley McLaughlin. It says, the policy is specifically for Compete USA events and approved performances. Classic and practice ice are under the discretion of the local program and numbers in the community. Thank you. I was hoping this would extend to Learn to Skate. But I hope that other coaches see this as a sign that they should continue to wear their mask or put their masks back on. And I hope that programs do the same. Here's why it's important to wear a mask in that situation. Because teaching skating, we're indoors with no windows, no doors, no real fresh air coming in. And the majority of the people that participate in Learn to Skate USA and private lessons are under the age of 12. Some of those that are older than 12 have parents that are somewhat hesitant to have them vaccinated. This is because, at least at this time, the vaccine does not have full approval. It only has emergency authorization, unfortunately. But hopefully full approval will come very soon, and more of our youth will be able to get the vaccine. Until that time, and until all the kids that I work with and are in the rinks can get vaccinated, it's really up to us to wear a mask. And if you're like me, you wear two, because we need to protect the kids from the virus and help stop the spread of Delta. We also have to protect ourselves and our families at home, because still most of the virus is spread by unvaccinated people. And I'm surrounded by kids that are unvaccinated because they just can't get vaccinated pretty much all the time. Plus, as I said in my earlier video, we're on an honor system with these vaccines. In most places, no one has to prove that they're vaccinated, but fortunately that's starting to change. New York City will start to require proof of vaccine for certain activities, and I sincerely would like to see more of that. Again, I got vaccinated way back in March, And I drove 100 miles each way, twice. And because we're now coming up on that being 6 months ago, I'm really hoping that boosters are going to be made available to us really soon. I know that many of you may be disappointed that you can't ditch the masks just yet. I know they're not the most comfortable thing. Believe me, I know. I wear the N95 with the UA featherweight, now the featherweight, but before that it was just the original sports mask. I wear both of these for sometimes hours on end while I'm wearing ice skates on a giant ice cube. It's a weird sport, isn't it? Coaching kids. I know it's not comfortable, but I do it anyway. And I don't take it off, not even to talk. So believe me, I totally get that you want to ditch the masks. I do. But for now, until more people, including children, are vaccinated, we'll need to keep wearing them. And if you can get vaccinated but haven't done it yet, and are watching this video, it's probably for a reason. I hope you get your vaccines very soon. Again, according to Dr. Mike Hansen, the vaccines have saved an estimated 275,000 lives and prevented over 1 million hospitalizations. And that's in the US alone. So get your vaccine and continue to wear your mask. Remember, I have that video coming up all about the microphone PA system that I use when I'm coaching on the ice so that the kids can hear me through the two masks. So be sure to subscribe and ring that bell so you don't miss the video when it comes out. You'll want to do that especially if you're a coach, a trainer, or a teacher. And if you found this video helpful, please hit the like button and share it with someone else it could help, and just post it to all your friends on your social media too. This is Amy. Thank you for watching. Continue to mask up. I will see you real soon. Bye.